explain to me how this makes sense, and I can go team go. I'm here to support.
I see if we can just bring it right here.
Yeah.
And we'll kind of focus our conversation
What do
to
we
get
want-
together
yeah.
that way, so that our voices hit the camera. It's bring.
So kind of talk.
Yeah, just the same thing we just did over there. Just kind of
Okay.
what we're doing.
It's Perritt like the bird. Oh, it's not on here. Perritt like the bird. Yeah. So this is Hum. Dr. Hum.
I got that one.
Not
You can handle that one.
Not Hugh.
Good.
Well, folks, this is Texas Senator Bob Hall, and we're here in Rockwall, which is in Senate District 2, talking to Dr. Hum and Dr. Perritt, along with David Sweet, the county judge.
Thank you, sir.
It's here on a brand new facility that's just opened up. Some of you may have remember the interview we did on last week with Senator Lois Colcourse, who heads up the Health and Human Services Committee in the Senate, and talking about Regeneron and the infusion centers that are out in Texas, some 270 plus centers throughout Texas. And the fact that most people didn't even know they were out there. This is a facility that's been set up for early treatment, something that has been ignored for about the last year in treating of COVID patients. And now we have some centers throughout the state, and this one in Rockwall just opened today, didn't it?
Yes,
That's
sir.
right. Okay, and you've had about how many patients so far?
Already unannounced, unadvertised, we've already seen 45 patients come through our facility to get early treatment for COVID-19. So this is in response to our local need. Hospitals overwhelmed seeing COVID patients. The one thing we can do to keep them out of the hospital is provide early treatment. So monoclonal antibodies are that one treatment that have shown to reduce hospital admissions by 70%. So what we really need to do is get the word out to the community that if you're diagnosed with COVID, you're in the first 10 days of symptoms, we need to see you here. We want you to get an appointment, be screened, make sure you're eligible, and get you over here. And we don't want you to wait until you feel terrible and get sick, like you feel like you need to go to the hospital. We want you early. We want you when you're just having those fever, chills, body aches, and symptoms you think are pretty minor. That's when you want to get this early treatment, and that's when this is most effective.
That's right. That's the thing that most people, oh, I just isn't so bad. I've got it. I just have a fever, a little runny nose, not so bad. When it hits you, it's overnight. It's very quick and it moves very fast. And the sicker you get, the tougher it is to recover from this. This is one of those. There's something that we unfortunately have not addressed in the last year. We've been too anxious to put people in the hospital or tell them just to go home and isolate in a very unhealthy environment that's inside without fresh air and no sunshine. But this is early treatment, and some of you may remember that when President Trump got the COVID, this is the treatment he received in the hospital that no one had heard of at that time. It was Regeneron. And so it has been approved for this, and we are trying to get the word out to everyone here. And what the doctor said is, you do need a prescription, you need to see a doctor, and to save you time and effort, get that before you come here. If you don't know one, we're going to put up on the website, probably should be up right now, both a map of the sites around Texas and the link that you can go to. You can make a copy of this, go to that link, put in your address, and it will tell you the infusion centers that are closest to you. Depending on how far you want to drive, you can put it in 10 miles, 15 miles, 50 miles, and find a facility. And we're also going to put up the links to doctors, frontline doctors, Association of American Physicians and Surgeons have a line of doctors that all do telemedicine. At myfreedoctor.com, there's a long list of them. Those names and numbers will be up there. You can talk to these doctors, and it's up to them, but you can get a prescription from them and then show up here for your treatment. Dr. Hum, you want to?
Yeah, Senator Hall, thank you. So just want to add that of the nearly 50 injections and infusions that we completed today, we had to turn away 2 patients because they waited 1 or 2 days too long and their oxygen level was too low, necessitating them to go to the hospital to be admitted. So early treatment is key. If you don't have that prescription from your doctor, we have a site that we can do an order on site to get you treated. So that's key, is don't let a doctor prescription from have you come to our site.
Early. Absolutely. And this is it is effective. We had a Senate hearing with hospitals and some of our state officials a couple of weeks ago, and our head of emergency management that was responsible for setting up the sites around the state initially, his testimony was that he had not seen anyone that had gotten the treatment with the infusion that went on to get sick and go to the hospital or die. And that speaks volumes for how effective this is. So the important thing is, they said, early treatment, don't wait. And the locations are up on our website, and they should be on the screen that you're watching or we're watching now. And we'll close this out. David, you want to say anything?
Just real quickly, thank you, Senator Hall, for coming out. Thank you for your support. We appreciate you coming out to visit and see the site in person. Doctor, speak specifically to the registration link for this site to folks throughout the entire area, but specifically with Rockwall County residents.
Absolutely. We have a simple registration process on our website. It's mdlabtx.com/MAB-registration. Again, mdlabtx.com/MAB-registration. Right from there, you can get registered to come get an appointment to come out here. Right now, for the first week, we're taking walk-ups. After that, it'll be registration and appointment only. And like we said, early treatment's going to be the most effective.
That's it. That'll be my last words that I would like to say on that would be, please, folks that are sitting at home, if you're watching this and you're COVID positive, this is those actions that you need to take, the steps you need to take to keep this thing or prevent this thing from escalating to where you'll find yourself in the hospital. So, services out here, please take full advantage of it.
Absolutely. One last thing, all the doctors or clinics that are watching this, if you wonder how can you become an infusion center, contact our office and we will give you the instructions that you need on who to deal with in dishes at the state level to begin the process to set up one in your area. We have a lot of areas of Texas that people have to drive 50 or 100 miles to get to, so we need more facilities around Texas to be able to treat patients so they don't have to drive so far. So contact our office, we can get that to you. In the meantime, go back and watch our video from last week. Learn a lot more about Regeneron and how it works. In the meantime, God bless you and God bless Texas.
Appreciate it.
Good to meet you face to face and not on Zoom.